York University Professor Alison Macpherson, who studies injuries in children and youth, has been awarded $925,000 by the Canadian Institutes of Health Research.
So we're going to look at bicycle helmet laws, for example, which would be preventing bicycle-related head injuries. We're going to look at body checking and injuries in hockey, particularly related to concussions in hockey. We're also going to look at injuries to children who should be in a booster seat but aren't. And there's a specific type of injury that they get when they're too young for a seatbelt, which can include a head injury and some injuries to their spleen and things like that.
Injuries result in more deaths of Canadian children and youth than any other cause.
So we're going to start locally with each province, with each policy. So we'll include a visit to the province, making those connections, some of which we already have, some of which we'll have to develop.
Professor Macpherson and her team will also continue to work with Aboriginal communities to develop culturally appropriate injury prevention policies.
We know that enacting legislation or changing legislation, it requires a lot of back and forth and a lot of work behind the scenes. So we're going to hopefully work with them to do that. And the ultimate goal, it would be great if there was some consistency in evidence-based policy for child health across Canada, particularly around body checking, bicycle helmet laws, booster seat laws, and graduated driver's licensing. And the reason we're focusing on those 4 things is because there's a high incidence of injury related to each of those areas. There's lots of evidence around interventions that actually work, which was important to us. And there's something can be done and is being done in some parts of this country around each of those things. I'm also going to work to address some of the concerns people have. So for example, around bicycle helmet laws, people are really worried that if you have a law that requires children to wear helmets, that they're going to stop riding their bikes. So we want to work around ways to make that message clear that it's not just about the bicycle helmet law, it's about promoting cycling, it's about cycling infrastructure, and it's about taking a holistic view of injury prevention. If all children did was sit on the couch and do nothing, they wouldn't get hurt. But that's clearly not at all the objective of our research. Our research is to have healthy, active, and safe kids.